Hello, dear aspirants. Welcome to GDC English classes. So, the main intention of the GDC English classes to break the language barrier and more comfortable to the students, especially from the South region, like South India region students. So, from the Kerala, Tamil Nadu, Karnataka, Andhra Pradesh. Okay, and especially this GDC English classes is providing coaching for Gpat, Sniper, Drug Inspector as well as pharmacist. And here now we are going to discuss regarding the previous year MCQs from the Gpat examination and we will discuss in detail along with the explanation. So we will go through the MCQs, we will see the answer and we will see the explanation. And regarding explanation, it will take much more time. That's why I'm going through the glimpse of explanation only. If you want, you can pause the video, you can make the screenshots, or you can write down your own notes. And if you are really preparing for the GPAT, from now itself also, the GDC launching a rankers batch. So every time, each year, the GDC GPAT Decision Center launches rankers batch. This time, the rankers batch is also going to launching on English language, especially for the South India region students. South India region students. If you are really interested, so contact the GDC management from the further GDC English classes. The fees is only 4,000 along with the materials. So the GDC materials are well known throughout India and GDC is the number one pharma platform for the GPAT, Sniper, Drug Inspector as well as pharmacist classes. So without delay, so let's go into our session, that is discussion of MCQs from the GPAT 2023 question paper, especially pharmacology MCQs from the shift 2, that is nothing but afternoon session. So here is the first MCQ is here. The first MCQ is here. Which of the following is correct in respect to voltage gated calcium channel? Voltage gated. Which of the following is correct in respect to voltage gated calcium channel? L-type calcium channels, nifedipine. Nifedipine is a vasodilator as a antihypertensive. T-type calcium channel, verapamil. N-type calcium channel, mibifradil. R-type calcium channel, diltiazem. I hope you know that nifedipine, verapamil, diltiazem are the drugs are antihypertensive drugs. They shows their action on L-type calcium channels. L-type calcium channel. L means long time opening. Once the ion channel is activated, it open for the long time. So you know simply the answer is L-type calcium channel nifedipine. T-type calcium channels present in the hypothalamus. T-type calcium channels blocked by ethosuximide, a anti-epileptic drug. Ethosuximide an anti-epileptic drug. So here it is the explanation in detail. So L-type, T-type, N-type. Activation threshold. So active for long time. L-type, T-type transient, N-type medium. And inactivation rate slow, fast, medium. So like this, here our focus is on mainly on the drugs. The examples of the drugs here for L-type calcium channel blocker, nifedipine, diltiazem, verapamil, and T-type mibifradin, flunarizine, ethosuximide, and N-type calcium channel blocker is omega conotoxin. Omega conotoxin, a analgesic. Omega conotoxin is an analgesic. So the answer is simply L-type calcium channel. L-type calcium channels. Which of the following drug is not meant for systemic use? So which of the following drug is not meant for the systemic use? Okay. So the options are like metilmycin, sizomycin, neomycin, paramomycin. So aminoglycosides. These are the compounds comes under aminoglycosides. Aminoglycosides nothing but amino sugars. They inhibit the protein synthesis in the bacteria by binding to 30S ribosomal subunits. So here metilmycin, sizomycin, neomycin, paramomycin. So which of the following drug is not taken through the parenteral route, not taken to the blood, directly to the blood? So which of the following drug is not meant for the systemic use? Neomycin. So neomycin, promycetin, neomycin, promycetin are the only two aminoglycosides. They preferred by topical route, not into the blood, not through the parenteral route. Neomycin, promycetin are the only two drugs they prefer by to show are nothing but they applied by topical route. They applied by the topical route. Neomycin will be the answer. So here the classification of aminoglycosides based on route of administration. Systemic aminoglycosides, GST का SNAP base है. Okay, and the topical aminoglycosides, sorry, topical aminoglycosides, neomycin, I hope you already having knowledge about Gpat mantra. So here it is the Gpat mantra, the second edition, new edition is already released. It is available in our GDC classes app also. So if you didn't download our app, so download GDC classes app from the Play Store. So Gpat mantra will definitely help to crack your Gpat examination. If you crack your Gpat examination, you will get your stipend around 12,400 per each month of your 2 years M.Com examination. Next MCQ. Which among the following is not used as a NSAID? Which of the following is not used as a NSAID, non-steroidal anti-inflammatory drug? Indomethacin extended release 75 mg, aspirin 75 mg, naproxen 500 mg, mefenamic acid 500 mg. So aspirin 75 mg for treatment of myocardial infarction. Myocardial infarction, MI. So as you know that aspirin is a NSAID, but aspirin NSAID dose will be the different around 500 mg like that more than that. But aspirin at the dose of 75 mg for treatment of myocardial infarction. Myocardial infarction. So we know that aspirin is chemically acyl salicylic acid. Aspirin is the only NSAID irreversibly blocks COX-1, COX-2 enzymes. No other NSAID having this property. So aspirin is the only NSAID having this property at high doses for treatment of inflammation and other condition, at low doses for treatment of myocardial infarction. Myocardial infarction. Next MCQ. Regarding the next MCQ, so what is here? Flight and the fighter response is mediated by. So flight and the fight response is other name of sympathetic nervous system, adrenergic nervous system. So parasympathetic in autonomic nervous system, sympathetic in autonomic nervous system, serotonin in the serotonergic receptors and histamine. So parasympathetic nervous system also known as rest and digestion activities. Sympathetic nervous system also known as flight or fight response. Flight or fight or response. I hope the question is very easy. The questions are easy when you have knowledge on the basics and concept level. Basics and concept level. And always the GDC, GPAD Distance Center GDC classes will always come through the basics and concept oriented only. And especially in the 2024 result of GPAD from the GDC, 2,500 students are qualified across India from the GDC platform, Gpat Distance Center. Because once you qualified in the GDC platform, definitely you will qualify. But it's your personal, how much rank you want, how top rank you want. So utilize the all classes and everything available in the GDC and go forward with the excellent rank. Okay. So the answer is simply flight or fight response is sympathetic nervous system, that is nothing but adrenergic nervous system. So parasympathetic, the differentiation between structural organization of sympathetic and parasympathetic. Parasympathetic origination from the craniosacral region. Sympathetic originate from the thoracolumbar region. So, under the main function of the parasympathetic store the energy, the major function of sympathetic invest the energy in the form of exercise. In the form of exercise. So for more details, so take the screenshot of this, or you can pass and you can study. And acetylcholine is a major neurotransmitter in the parasympathetic. There is adrenaline is a major neurotransmitter in the sympathetic. So next, the following MCQ is regarding the following MCQ. So regarding following MCQ, I hope not only pharmacology, from all the subjects of your GPAT syllabus, we are making the MCQs with explanation of previous year MCQs. If you are feeling comfortable or if you require any changes, so kindly let me know in the comment box. Definitely we will try our best to resolve your problems, and definitely it will be helpful for us in the form of your feedback. Next. Which one of the following is an autosomal dominant syndrome in its inheritance? So which one of the following is an autosomal dominant syndrome in its inheritance? So Gilbert's syndrome and the Crigler-Najjar syndrome type 1, Dubin-Johnson syndrome and the Rotar syndrome. So like these questions are little bit tricky and these are not occasion. These questions are like occasional questions. So the answer is Gilbert's syndrome. So it is an autosomal dominant through inheritance. Through inheritance. So what is simply this Gilbert's syndrome? So it is nothing but a autosomal dominant disorder. Autosomal dominant disorder, and especially it is related to the conjugation. It is related to the conjugation, nothing but a phase 2 metabolism conjugation reaction. And especially it is mainly because of deficiency of uridine diphosphate glucuronoside transferase. Uridine diphosphate glucuronoside transferase is one of the enzymes essential for the conjugation reaction, glucuronide conjugation. Glucuronide conjugation is a major phase 2 drug metabolic reaction. Major phase 2 drug metabolic reaction. Next, one of the following is correct. So here, this is a little bit long question. So be patient. Patience also is one of the key for the success. So let's have a detailed discussion on this MCQs. So if you having real patience and having excellent knowledge, nothing but if you have more patience to observe like these questions, definitely you also more successful in the competitive orientation. Definitely your patient level is also very big patience level. So M1 acetylcholine receptor conformed to brain. M2 acetylcholine neural receptor. M3 acetylcholine cortic receptor. M4 are glandular receptors. So first of all, M1, yes, M1 is belongs to the brain. In the brain, acetylcholine to M1 receptor regulates memory. M2 receptors, neural. Generally, M3 receptors, cardiac. Cardiac are M2 receptors. Cardiac are M2 receptors. And M4 not generally a glandular. M3 will be the glandular receptors. Present on the glands, M3 receptors. Like salivary glands, bronchial glands, gastric glands. Next option B. M1 acetylcholine receptors confirmed to neural no. M2 acetylcholine brain receptor no. M3 acetylcholine cardiac no. M4 are glandular. This is also no. And next option C. Option C. So regarding option C, M1 acetylcholine receptor confirmed to neural. M2 acetylcholine cardiac. M2 receptor present on the heart. M3 glandular. M4 brain. M4 brain. Next option D. Next is the option D. Regarding option D, M1 acetylcholine receptor glandular no, M2 acetylcholine neural no, M3 acetylcholine brain no, M4 cardiac no. So M2 receptor belongs to the heart. M2 receptor belongs to the heart. So let's see option 3, option C. M1 acetylcholine receptors to neural brain, M2 heart cardiac, M3 glands, M4 again brain. M4 again brain. So the answer will be the option C. M1 neural, M2 heart, M3 glands, M4 brain. All these are muscarinic receptors. All muscarinic receptors are belongs to the G protein coupled receptors. G protein coupled receptor. So in the parasympathetic nervous system, cholinergic receptor, nicotinic receptors, muscarinic receptor. Nicotinic neuronal or nicotinic ganglia. Muscarinic receptors 5 types. All muscarinic receptors are G protein coupled receptors. All nicotinic receptors are ion channel or inotropic receptors. So receptors are like a formulas for the pharmacology. So please be have thorough knowledge on receptors pharmacology. Next. So next MCQ is, so let's have a look on the following MCQ. Following MCQ. So dash is a protein marker which can be detected within 3 hours of acute ischemic kidney injury from the patient urine. So dash is a protein marker for the detection of can be detected within 3 hours of acute ischemic kidney injury from the patient urine. Ischemia, particular part of the body unable to receive proper blood, unable to receive oxygenated blood. That leads to the area become inactive, dead, ischemic. So the detection marker will be the N-acetyl beta glucose amylase, glutathione S transferase, neutrophil gelatinase associated lipocalin, gamma glutamate transferase. So the marker for the detection of acute ischemic kidney injury is neutrophil gelatinase associated lipocalin will be the marker for detection of acute ischemic kidney injury within the 3 hours. Within the 3 hours. Within the 3 hours. So especially the N-acetyl glucosamidase is an enzyme found predominantly in the lysosomes of the proximal tubules of the kidney. It is an important nephrotoxicity biomarker. Biomarker. Next. The next MCQ. Which of the following gene is responsible for graft rejection in the human? So graft rejection, nothing but rejection of organ transplantation. Graft rejection of organ transplantation. So let's have look here. Which of the following gene is responsible for graft rejection in the humans? Graft rejection, like organ transplantation. If we perform transplantation of an organ from one person organ to another person, so organ transplantation means other person organ. So if that organ entering into someone body, immune system will oppose. That is known as rejection. So highly polymorphic HLA gene, HMSH2, APP gene, and FMRI gene. So which of the following gene is responsible for the graft rejection? The gene is highly polymorphic HLA gene is responsible for the graft rejection in the humans. So especially have a discussion here. So rejections occurs when the recipient's immune system recognizes the donor tissue as a foreigner tissue, triggering our own immune system. It may lead to autoimmune reaction. So especially major histocompatibility complex markers specifically identified as a human leukocyte antigens. HLAs and what human leukocyte antigens, they involves in the rejection. They involves in the rejection fraction, nothing but rejection of organ transplantation. So match the following column with column 2. Match the following column with the column 2. So here, first one is vibration in skeletal muscle of the larynx. Involuntary contraction of skeletal muscle. Contraction of skeletal muscle in the legs. Pull of skeletal muscle on attachment to the skin led to the heart. And causes facial. Sorry. So that is come here. So PQRS. Okay. Assist return of blood to the heart. So vibration in the skeletal muscle of larynx regulate the voice cue. Involuntary contraction of skeletal muscle, facial contraction. Contraction of skeletal muscle in the legs, shivering. Pull of skeletal muscle on attachment to the skin. Assist return blood to the heart. And especially, and another one is causes facial expression. Another option will be the causes facial expression. So the MCQ, the answer is here. Option C, QRST. So QRST. So one is the Q that we already know that, and I already told you that vibration in skeletal muscle larynx is Q, that is regulate the voice. Next, option 2 R, involuntary contraction of skeletal muscle leads to shivering, leads to shivering. Next, option 3, yes, sir. Option 3, yes, sir. Contraction of skeletal muscle in the legs assist return of blood to the heart, assist return of blood to the heart. And option 4 is D. Option 4, full pull of skeletal muscle on attachment to skin, that is causes facial expression, that causes facial expression, that causes facial expression. Next. So here clearly I mentioned. So go through it, or otherwise if you need, you can take the screenshot also. You can take the screenshot also. So the next MCQ. Most common types of megaloblastic anemia caused by malabsorption of vitamin B12 and characterized by decreased production of HCl in the stomach and a deficiency of intrinsic factor. Yes, deficiency of intrinsic factor. So especially most common type of megaloblastic anemia caused by malabsorption of vitamin B12 that can be characterized by decreased production of HCl in the stomach and a deficiency of intrinsic factor. So deficiency of intrinsic factor, decreasing production of HCl and malabsorption of vitamin B12 can lead to iron deficiency anemia, sideroblastic anemia, pernicious anemia, aplastic anemia. So I hope you know the answer simply. The simple answer is nothing but here different factors I clearly mentioned. So deficiency of vitamin B12 and characterized by decrease in HCl and also deficiency of intrinsic factor. So intrinsic factor is essential for the vitamin B12 absorption. Intrinsic factor is a protein produced in the GID along with HCl. The intrinsic factor is essential for vitamin B12 absorption. Because of deficiency of vitamin B12 due to decreasing production of intrinsic factor, there is a lack of vitamin B12 absorption. Malabsorption of vitamin B12 leads to pernicious anemia, leads to pernicious anemia, pernicious anemia. Okay, next. Which of the following is not a ACE inhibitor, angiotensin converting enzyme inhibitor? Which of the following is not a angiotensin converting enzyme inhibitor? So, captopril, lisinopril, verapamil, tandolafil. So, all pills, wherever it may be neutral. Till now, you didn't sign any textbook, but it having a prill in its ending. That prills are nothing but angiotensin converting enzyme inhibitors. But here it is a verapamil. It is a mill, not prill. Verapamil is a L-type calcium channel blocker as an antihypertensive drug. So this is an easy question. You can easily answer. But always basics are very very important. So this is a classification of drugs acting on renin angiotensin aldosterone system as well as a diuretics, as well as a diuretics. All pills are ACE inhibitors. All sartans, all sartans are angiotensin receptor blockers. Angiotensin receptor blockers. Next, the next MCQ is let's have a look. Which of the following combination is correct? Which of the following combination is correct? So here, nucleoside reverse transcriptase inhibitors, ritonavir. Ritonavir is a protease inhibitor. Protease inhibitor indinavir, correct. Integrase inhibitor, saquinavir. Saquinavir is also a protease inhibitor as an antiviral. Non-nucleoside reverse transcriptase inhibitor, tenofovir. Tenofovir. So the correct combination is protease inhibitor indinavir. All navils are protease enzyme inhibitors and prevent the replication in the virus. Replication in the virus as a antiviral drug. As an antiviral drug. So the correct combination is protease inhibitor is navir. All navils, indinavir, nelfinavir, ritonavir, atazanavir. All navils are protease inhibitors that helps in the decreasing the replication of virus cycle. Replication of virus cycle. And this is a detailed classification of antiretroviral drugs, specifically acts on HIV-1 and HIV-2 virus. HIV-1 as well as the HIV-2 virus. Next, choose the most appropriate answer. Choose the most appropriate answer. Okay, so next MCQ is Choose the most appropriate answer. Choose the most appropriate answer. So here, Enterobius vermicularis, that is Strongyloides tercovalis, Voceraria bancrafti, Dracunculus medicinis, Dracunculus medicinis. So generally, so this is also like very rare questions, and this is from the different worms and their names. So here, the option C will be the correct. A, B, C, D, all are correct. A, B, C, D, all are correct. So Enterobius vermiculus pigworm, Strongyloides tercovalis threadworm, Voceraria bancrafti filaria, and Dracunculus medinenis guinea worm. That is guinea worm. So answer option C is the answer. Option C is the answer. And here it is a table. So different types of worms and their respective names. Nematodes, cestodes, trematodes. Trematodes flukeworm, cestode tapeworm, nematode roundworm. So have a snap or screenshot of this table. Definitely it is important for your Gpat preparation. Next. Next MCQ is regarding the next MCQ. Activate activate G protein gated potassium channel resulting in the membrane hyperpolation. Activate G protein gated potassium channel resulting in the membrane hyperpolation. So through alpha 1 receptors, through alpha 2 receptor, through alpha 1 adrenergic receptor, through alpha 2 adrenergic receptor. So activate G protein gated potassium channel resulting in membrane hyperpolation, alpha 1 adrenergic receptor, alpha 2 adrenergic receptor, alpha 1 adrenergic receptor, alpha 2 adrenergic receptor. So there's a little bit uh, inconvenience in the MCQ here, little bit inconvenience. So generally alpha 1 adrenergic, alpha 2 adrenergic, alpha 1 adrenergic, alpha 2 adrenergic. So generally the options are multiple. They came two times. But here, hyperpolarization because of alpha 2 receptor. Alpha 2 receptors are autoreceptors. Autoreceptors are activated. They inhibit the release of their own neurotransmitter and causes hyperpolarization of a membrane, relaxation of a membrane, relaxation of a membrane, relaxation of a membrane. So alpha 2 receptors are nothing but they connected to the inactive G protein. So what is inactive G protein? Inactive G protein leads to decreases cyclic AMP levels. So decreases cyclic AMP levels, decreases calcium and also increase efflux of potassium. So no calcium into the cell and potassium is also going outside of the cell. The cell may become hyperpolarized because of negative voltage, So coming to alpha 1 receptor binds to G2 IP3 DAC pathway and beta 1 binds to GS cyclic AMP pathway and beta 2 also same cyclic AMP pathway. So alpha 2 receptors increase the potassium activation and increase the efflux of potassium from inside of the cell to outside of the cell and causes hyperpolation of a cell membrane, relaxation of a cell membrane. Which among the following statement is correct with respect to their mechanism of anti-diabetic action? So here simply, so list of anti-diabetics along with their mechanism mentioned, we have to select the correct one. We have to select the correct one. So dapagliflozin, canagliflozin, sodium glucose co-transporter 2 inhibitors. So all gliflozins are sodium glucose transporter 2 inhibitors in the kidney. And the glipizide, gliclazide, dipeptidyl peptidase inhibitors. No. Linagliptin, alogliptin, AMPK activators. AMPK activators are biguanides. Acarbose, O-glucose, potassium ATP channel blockers. No. Acarbose, O-glucose are enzyme inhibitor responsible for glucose absorption. Alpha glucosidase enzyme inhibitors. So here the correct combination dapagliflozin, canagliflozin are the drug inhibit sodium glucose transporter 2 in the kidney and increase the excretion of excess glucose from body to outside of the body helps in the treatment of diabetes, helps in the treatment of a diabetic patient. The correct answer is option A. Correct answer is option A. And this is a detailed classification of the anti-diabetics. Anti-diabetics. So everything having unique, like so glitazones will be there, bicoanates will be there, sulfonylureas will be there. Each class of drugs are having unique mechanism of action. So this is a detailed classification. You can take your own screenshot or snap. And the next will be which of the following are biochemical observation in case of Graves' disease? Which of the following are biochemical observation in the Graves' disease? Let me a thyroid gland, Graves' disease. So, decreased ionized calcium in body fluids, decreased T3 T4 in blood circulation, increased ionized calcium in body fluids, increased T3 T4 in the blood circulation. So, especially the Graves' disease is an observation regarding the disease of your thyroid gland. Especially this is because of increase in T3 T4 hormones. Graves' disease. Graves' disease is a disease because of due to excess T3 T4 hormones in the systemic circulation. Nothing but a blood, nothing but a blood. Graves' disease is a also known as Graves' disease is also known as a autoimmune disorder. Also known as a autoimmune disorder that can cause hyperthyroidism or overfunction of the thyroid gland. Overfunction of the thyroid gland. Overfunction of the thyroid gland. That leads to excess levels of T3 T4 hormones in the circulation, blood circulation, matter blood. So let's have a look on following MCQ. So regarding here, laboratory finding of which one of the following disease include markedly elevated serum amylase levels during the first 24 hours, followed by rising serum lipase levels within 70 to 96 hours. Within the 70 to 96 hours. So simply increasing serum amylase levels in the first 24 hours, followed by rising the serum lipase levels within the 70 to 96 hours. Within the 72 to 96 hours. Okay. So here simply, so rising of serum amylase, rising of the serum lipase will be observed in the among this disease like options are acute pancreatitis, cirrhosis of liver, jaundice, cystic fibrosis of lungs. So acute pancreatitis, acute pancreatitis, acute pancreatitis. Next. So this is detailed regarding the diagnosis details in the form of explanation. And next, exenatide. So simply exenatide is an anti-diabetic drug, but you have to select the answer from the given options. What is exenatide? Exenatide, a glucagon-like peptide 1 receptor agonist, diphenyl peptidase DPP4 inhibitors. No, all DPP4 inhibitors are gliptins. All DPP4 inhibitors are gliptins. Sitagliptin or vildagliptin. And facilitator of glucose transporter ectolysis, no? Inhibitor of glucose absorption in the GAT. So glucose absorption in the GAT inhibited by acarbose, a alpha glucosidase inhibitor. Exenatide is a glucagon-like peptide 1 receptor agonist. So agonism of glucagon-like peptide 1, agonism of glucagon-like peptide 1 leads to increasing insulin function, decreasing glucagon function that leads to reduction in the blood glucose. The answer is simply option A. Glucagon like peptide 1 receptor agonist leads to increasing insulin function and helps in reduction in the blood glucose levels. So this is the same classification to the before already we mentioned. So where another anti-diabetic question in the previous slides, another anti-diabetic question in the previous slide. Next. Next is the which of the following is a third generation cephalosporin? You know, cephalosporins are the antibacterial compounds, nothing but antibiotics. They inhibit cell wall synthesis in the bacteria and shows bactericidal action. And there are 5 generations of cephalosporins. And here the MCQ is simply identify which of the following cephalosporin from the third generation. Cefazolin, cefuroxime, cefotaxime, cefepime. Cefepime is a fourth generation. Cefepime is a fourth generation. So definitely it will be the cefotaxime. Cefotaxime second generation, cefazolin first generation, cefotaxime second generation, and cefepime fourth generation, and cefotaxime belongs to the third generation of the cephalosporins. Third generation of cephalosporin is cefotaxime. So most of the third generation will be the oxime or axime. So most of the third generation cephalosporins you can observe they contain taxine, zoxime, ceftriaxone, ceftazine, cefalperazone, cefixime, oximes. Okay, so this is a detailed classification of cephalosporins based on their generations, including based on their route of administration, including based on their route of administration. So have a look here by passing the video. So here, like these questions are so common in the competitive orientation. So here the question is simply deficiency of which enzyme is found in the HERS disease, HER liver. So HERS disease, HERS, muscle glycogen phosphorylase, liver glycogen phosphorylase, phosphofructokinase, glucose 6-phosphatase. So due to deficiency of which of the following enzyme, there is a development of health disease. There is a development of health disease. So especially when I'm studying for the Gpat, I remember like her liver. So deficiency of liver glycogen phosphorylase enzyme may develop Hertz disease. So what is simply Hertz disease? So Hertz disease is caused by deficiency of liver glycogen phosphorylase. Phosphorylase. Due to deficiency of this enzyme, the organ will be affected with the liver. Organ will be affected or organ primary involved is the liver. So this is very very important table. Definitely these are the list of the diseases. On these diseases and deficiency of enzymes only. Many times they ask questions in the competitive exams. Many times they ask questions in the competitive exams. Next, which of the following is correct mechanism? Which of the following is correct mechanism? Select. So select the following correct mechanism. Select the following correct mechanism. Okay. So methotrexate inhibit the microtubule damage. No, methotrexate is a folic acid antagonist. Vinca alkaloids anti-metabolic drug inhibit the purine synthesis. No, Vinca alkaloids assist the cell division in the cancer cells. Bleomycin inhibit RNA synthesis. 5-fluorouracil inhibit the DNA synthesis. 5-fluorouracil inhibit the DNA synthesis. Okay, very good, correct. But remaining things are incorrect. Next, methotrexate inhibit the purine synthesis. No. Vinca alkaloids affect the microtubules. Yes. Vinca alkaloids affect the microtubules. Yes. Bleomycin inhibit DNA synthesis. 5-fluorouracil inhibit the 2-deoxythymidine. Okay. But here also there is a wrong is that methotrexate not affect the purines. Next, methotrexate inhibit the DNA synthesis. Vinca alkaloids inhibit the microtubule damage. Bleomycin inhibit 2-deoxythymidine. 5-fluorouracil inhibit the RNA synthesis. And option D, methotrexate inhibit the DNA synthesis. Vinca alkaloids inhibit RNA synthesis. No. And bleomycin anti-metabolic drugs. It is not an anti-metabolic drug. 5-fluorouracil is a 2-deoxythymidine. No. So bleomycin option D also wrong. So the correct option is so simply option C. Option C will be the not options. Methotrexate inhibit the purine synthesis. Methotrexate mainly inhibit the sorry for my inconvenience. So methotrexate option B. Methotrexate inhibit purine synthesis. Vinca alkaloids yes microtubules. Bleomycin DNA synthesis. 5-fluorouracil inhibit the 2-deoxythymidine. Answer is the option B. Answer is the option B. Especially methotrexate acts on the S phase also may inhibit the DNA synthesis. Okay, sorry for that. I also confused that. So here is the answer is option B. Clearly observe the option B and don't confuse yourself like me. So let's have a look on the following MCQ. Following MCQ. So what is here? The beta adrenergic antagonist propranolol 20 to 120 mg per kg is prescribed around 50% of maniac patients receiving lithium is to mitigate which side effect. So the beta adrenergic antagonist propranolol in non-selective beta blocker is prescribed around 50% of manic patients receiving lithium to mitigate, to control its side effect. So, if the person is taking lithium carbonate for treatment of malaria, that lithium carbonate produce some side effect. To control that side effect, propranolol will be administered. So, which side effect should be decreased by administration of propranolol? Administration of propranolol. So, the options are like anxiety, tremors, hypertension, bradycardia, hypertension, bradycardia. So generally, propanol having many number of applications. Propanol having many number of applications, especially the lithium may produce tremors, the unwanted unusual muscle contraction. That unwanted unusual muscle contractions can be controlled by propranolol, especially blocking the beta 2 receptors on the skeletal muscle. By blocking beta 2 receptors on the skeletal muscle, they decrease the unwanted tremors. By blocking beta 2 receptors in the skeletal muscle, that leads to decrease in tremors, nothing but unusual shivering. So lithium may produce tremors as a side effect. That side effect can be controlled by propranolol, a non-selective beta blocker, and especially the action achieved by propranolol by blocking beta 2 receptors, in the skeletal muscle, on the skeletal muscle. Next, which class of antibody? Okay. Which class of antibody opsonizes antigens for phagocytosis through two different pathways? Which class of antibody opsonizes antigens for phagocytosis through the two different pathways? Option like immunoglobulin G, immunoglobulin M, immunoglobulin A, and immunoglobulin A. So these are immunoglobulins. These are also having unique features. The answer is immunoglobulin G. The antibody opsonizes antigen for phagocytosis through different pathways. So this is the explanation. One pathway, FC receptor pathway. Other pathway is complement activation pathway. So I hope already. So still this is a February. We exactly the today date is the 9th. So on nothing but if you are really looking for Gpat examination and if you need coaching, so GDC English classes going to launch a new batch from February 17th, and definitely it will be this batch will run for 3 to 4 months. Within this 3 to 4 months, we will try to complete the syllabus. Daily we have 6 to 9 p.m. live classes and MCQ sessions, YouTube live sessions like this MCQs with explanation also will be there, and we'll provide the materials also. If you are looking forward for this rankers batch and upcoming new batch for 3 to 4 months of GPAT coaching from the GDC English classes, so you can message to the comment box or you can directly contact the management of the GPAT Discount Center and myself, coordinator of GDC South region. Next. So regarding the next MCQ, which of the following anti-rheumatoid drug is contraindicated in patients with renal as well as hepatic impairment? So which of the following anti-rheumatoid arthritis drug should not be taken in case of renal as well as hepatic impairment patient? The patient is having defect in the kidney as well as liver. Sulfasalazine, methotrexate, corticosteroids, azathioprine. So all these are rheumatoid drugs for treatment of rheumatoid arthritis, but methotrexate is a drug should not be preferred if the patient is suffering from kidney as well as liver damage or impairment. Okay, so methotrexate should not taken by pregnant women and it may decrease the effectiveness of the kidney. It may cause liver disease like inflammation or cirrhosis of the liver. Cirrhosis of the liver. Next, which of the following drug is an which of the following drug is an um, which of the following drug is an amino alcohol analogous that has weak visceral anticholinergic activity but is a strong nicotinolytic, block the nicotinic receptor? Which of the following drug is an amino alcohol analogous with a weak withdrawal anticholinergic action but with a strong nicotinolytic drug? Block the nicotine receptor. Biperidine, orphanodrin, Pauldine, propantherine. Pauldine as well as propantherine. So propantherine nothing but amino alcohol analog. Propantherine the option is generally regarding chemistry. It is known as a I think propantherine is a amino alcohol ether. Amino alcohol ether. Biperidine. Biperidine is the answer. Biperidine will be the answer. It is having strong nicotinolytic action as an antagonistic action on the nicotinic receptor. Nicotinic receptor. So generally, biopridine is a oral anticholinergic predominant for treatment of symptomatic therapy for treatment of Parkinsonism and also a movement disorder. Biopridine, strong anticholinergic drug. Pauldine, a procyclin. Procyclin also known as Proaldine, anticholinergic for treatment of Parkinson. Propantherine, strong anticholinergic properties for treatment of gastrointestinal disorder like ulcer, gastrointestinal disorders like the ulcer. Next, next is which of the following interfere with the release of cholinergic neurotransmitter acetylcholine by neurons of autonomic nervous system? So, which of the following drug interfere with release of cholinergic neurotransmitter acetylcholine by the neurons of autonomic nervous system? By the neurons of autonomic nervous system. Reserpine, guanethidine, hemicolinium, botulinum toxin. Botulinum toxin interfere with release of acetylcholine from presynaptic cholinergic neurons to postsynaptic cholinergic neurons. That is botulinum toxin. Botulinum toxin as a botax present in the plasmodic preparation. So botulinum toxin interfere with release of acetylcholine from the presynaptic cholinergic to postsynaptic cholinergic. Postsynaptic cholinergic. So here clearly I mentioned botulinum toxin block the acetylcholine release from the presynapse to postsynapse. So mesamicol interfere with the vesicular storage of acetylcholine causes metabolism of acetylcholine. Hemicolinium inhibit the synthesis of acetylcholine. Inhibit the synthesis of acetylcholine. Which one of the following of hepatitis can lead to fulminant hepatitis causing massive hepatic cell death more frequently among infected pregnant women, showing the third trimester relatively as high as 30%. So, fulminant means severe, dangerous. Fulminant hepatitis. Fulminant hepatitis. Which one of the following type of hepatitis can lead to fulminant hepatitis causing massive hepatic cell death more frequently among infected pregnant women, showing third trimester mortality as high as 30%. Third trimester mortality as high percent as 30%. Okay, so here, the answer is simply hepatitis A. So, hepatitis A is a dangerous and it is also frequently in the infected pregnant women also. So, that is answer is hepatitis A. And here, different types of hepatitis along with their important points. Hepatitis A virus, hepatitis B virus, hepatitis C, hepatitis delta, hepatitis E as well as hepatitis G virus, hepatitis G virus. Next, phocomalia caused by. This is also very basic question, and most of the students who are having interest on the pharmacology, they definitely know. Phocomalia, a loss of limbs. The, the person, the pregnant woman who took thalidomide drug into their body, their babies are born with half hands, half legs. That is phocomalia. Phocomalia caused by glibenclamide, indapamide, glutamide, thalidomide. Thalidomide will be the answer. This is a common question. Most of the student can easily give the answer. That is thalidomide. Thalidomide. I hope you know about thalidomide. Right? So here are the different list of drugs along with their dangerous side effects. Dangerous side effects, especially in the baby growing in the mother womb. Baby growing in the mother womb. Next. Okay, the next MCQ is very clear. That is valproic acid, carbamazepine, both are anti-epileptic drugs. used as the first line drugs for management of following types of seizures, both partial and tonic-clonic seizures, both tonic-clonic and status seizures, only febrile seizures, both febrile and status epilepticus. So especially these are mainly for treatment of both partial as well as tonic-clonic seizures, both partial as well as tonic-clonic seizures. That is the simple answer. Partial and tonic-clonic seizures effectively treatment by using carbamazepine as well as valproic acid. Valproic acid can block calcium channels, sodium channels in the neuron and can increase the GABA activity and decrease the sequence or nothing but incidence of seizures. When coming to the carbamazepine is a sodium channel blocker like phenytoin. So this is a detailed classification of anti-epileptic drugs based on their clinical applications, based on their clinical uses. Next, which of the following is not a sulfonamide derivative? Which of the following is not contains a sulfonamide group in structure? So example like almotriptan, so sumatriptan, rizatriptan, naratriptan. All triptans are for treatment of migraine. All triptans are treatment for migraine. And here the question is, which of the following triptan does not have sulfonamide group in structure? The answer is simply rizatriptan. Answer is simply rizatriptan. So always it is very excellent if you study pharmacology along with chemistry. So like this study will improve your interest and you can easily remember the number of things because your focusness increases. If your focusness increases, the things easily enter into blood-brain barrier and store in your brain and it will boost your confidence levels also. It will boost your confidence levels also. So here, sumatriptan containing sulfonamide, almotriptan sulfonamide, rizatriptan does not having sulfonamide group, naratriptan is also having sulfonamide group in structure. Sulfonamide group in structure. All triptans are for treatment of a migraine. All triptans are for treatment of a migraine. Okay, so this is the last question of this video. Which of the following cell cycle phase has short duration? I hope this is a basic question from the intermediate level itself, plus 2 level itself. Which of the following cell cycle phase has shortest duration? G phase, G2 phase, M phase, S phase. M is the shortest phase, that is the M is nothing but mitotic cell division. Mitotic phase nothing but a cell division phase. Cell division phase. So this is a explanation of this MCQ. So different phases, on different phases, our anti-cancer drugs also showing their action. M phase is the shortest, means regarding duration. G1 phase is the longest regarding the duration, longest regarding the duration. And here it is different phases of the cell cycle and in the regard of anti-cancer drug targets along with their example. Anti-cancer drug targets along with their examples. So this is regarding our discussion of this video of previous year Gpat MCQs. We are really looking for a good future and good success in your upcoming life. So definitely GDC will help you and you can crack anything with the GDC platform, the number one pharma platform. If you are looking for any coaching, so don't hesitate to contact us. So myself, Ashok Kumar, I am the coordinator of GDC classes South Region. Thank you. All the best. Subscribe to GDC English classes. So share this channel to your faculty as well as your juniors, seniors, and definitely they also learn a quality education from the GDC platform. Thank you.